Today we're going to talk about Crohn's disease. Crohn's disease is a chronic bowel inflammatory disease that can affect any part of the GI tract, starting from the mouth to the anus. Crohn's disease is also known as Crohn's ileitis or regional enteritis. As the name implicates, it most commonly affects the small intestines. To be more specific, it most commonly affects the terminal ileum. Now, talking about the etiological factor of Crohn's disease. Crohn's disease is known to be an idiopathic chronic inflammatory disease. It is of unknown cause of multiple contributing factors that are found. However, recent theories have suggested it might be immune related. Now talking about the effect of Crohn's disease on the mucosal lining of the colon, here we can see a comparison in the mucosal lining of a healthy individual and a patient with Crohn's disease. As you can see in the mucosal lining in this endoscopic picture, we can see the development of multiple abscess, ulcerations, fistulas formation, areas of stenosis and obstruction, narrowing the GI tract, giving a cobblestone appearance for the mucosal lining, which is considered to be a characteristic feature of Crohn's disease, which is the cobblestone appearance. There's another picture that shows us the effect of Crohn's disease. It causes inflammation, it causes stenosis, it causes fistulas formation, as we can see here, or are features of Crohn's disease. Now, who is at risk of developing Crohn's disease? Crohn's disease affects two age groups with two peaks. The first peak, which is the most commonly affected group, is between the age of 15 and 30 years old. And the second peak is between the age of 60 and 80. Crohn's disease can affect both individuals or both genders, males and females equally. One of the major risk factors for the development of Crohn's disease is smoking, and these are considered to be of the modifying risk factors. For the symptoms of Crohn's disease, we have early signs and symptoms that can aid in the detection of Crohn's disease, and we have late signs and symptoms. For the early signs and symptoms, abdominal pain and cramping, diarrhea, fever, weight loss, bloating is considered to be of the early signs and symptoms that might give you an idea. As in this picture, we can see that it also causes skin rash, weight loss as a result of recurrent diarrhea, abdominal pain, arthritis, anemia, sweating, abscess ulcers. For the more advanced signs and symptoms, it causes rectal abscess and fissures formation with anal pain or drainage. For the symptoms outside the intestines, as we can see or we can notice that it can affect multiple organs, making it a multisystematic disease affecting multiple organs. Eyes causing redness and itching, mouth, which we will talk in more details about the oral manifestations, joints causes arthritis characterized by pain, swelling, inflammation. It can also affect the skin, causing the development of bumps and other lesions, bones causing osteoporosis, particularly postmenopausal women, kidney as it causes the development of renal stones, and more rarely affecting the liver, causing the development of hepatitis. For the oral manifestation, which is the main focus in our lecture, is to talk about the oral manifestations of Crohn's disease, as they are extremely important because of two main reasons. First, the oral manifestations are considered to be of the early signs and symptoms that can help in the detection of a Crohn's disease. And the second cause is that their severity may be used as a marker of the disease. Now talk about the most common symptom or oral manifestation of Crohn's disease, lip swelling. As we can see here in the picture, it causes a diffuse swelling in the lower lips. It causes labial and gingival swelling. It causes cobblestone appearance of the buccal mucosa and the mucosal lining of the colon. It gives areas of irregularities in the mucosal lining. It causes the development of mucosal tags. Causes the development of aphthous-like ulcers and angular cheilitis. For the diagnosis of Crohn's disease is commonly mistaken to multiple other GI diseases because of the similarities in the signs and symptoms. Multiple tests are performed to diagnose Crohn's disease, CBC test and CRP test. We can take a biopsy of the oral lesion. A biopsy of the oral lesion particularly shows non-caseating granulomas. We can perform endoscopy and a barium follow-through X-rays in the small intestines or a colonoscopy in the colon and the terminal ileum. One major test that we use to differentiate it from the most commonly mistaken disease is ulcerative colitis. Crohn's disease and ulcerative colitis, these are considered to be one of the major diseases that affects the GI tract, particularly the intestines, and are commonly mistaken due to the similarities or partial similarities in the signs and symptoms. The disease that we mainly perform, the test that we mainly perform to differentiate between these two is ASCA and ANCA, autoantibodies test. And now talking about Crohn's disease and ulcerative colitis, how to differentiate between the two in terms of signs, symptoms, pattern of progression, and the affected site. Crohn's disease signs and symptoms includes abdominal pain and cramping, diarrhea, nausea, vomiting, and weight loss. In comparison to ulcerative colitis, which is considered to be a more aggressive disease, it causes bloody diarrhea. The presence of blood in the diarrhea is an indication of a more aggressive disease, which is ulcerative colitis. It can also cause rectal bleeding and abdominal pain. For the most commonly affected site, Crohn's disease can affect the entire GI tract, however, more specifically affecting the ileum, in comparison to ulcerative colitis, which solely affects the colon. For the pattern of progression, Crohn's disease has a discontinuous pattern through the GI tract, meaning that it affects segments and spares another, giving a discontinuing pattern of disease in comparison to ulcerative colitis, which has a continuous pattern starting from the rectum and progressing through the colon. Why it's important to know the differences between Crohn's disease and ulcerative colitis? Because we have different medications that are effective for both situations, different surgical treatment options for the treatment of Crohn's disease and ulcerative colitis. We also have a more detailed comparison of Crohn's versus ulcerative colitis. Site of origin, pattern of progression, as we said before, Crohn's disease has a discontinuing pattern, skip lesions or irregular pattern of disease, comparison to ulcerative colitis, which is proximally contagious, which means it has a continuous pattern of progression. The thickness of inflammation in Crohn's disease is transmural in comparison to ulcerative colitis, which might be mucosal or submucosal. Symptoms and complications. For the complications, it causes fistulas, abscess, obstructions, and ulcerative colitis causes hemorrhage, toxic, and megacolon. For the risk factor, this of particular importance between Crohn's disease and ulcerative colitis. Crohn's disease slightly increases the risk of colon cancer in comparison to ulcerative colitis, which causes a marked increase in the development of colon cancer. For the surgical intervention, we usually seek surgical intervention as a last resort in Crohn's disease when the development of complications such as strictures occur, in comparison to ulcerative colitis in which surgical intervention is curative.